The best in talk radio every day on 1290 WHKY.
First Talk with Hal Rowe, WHKY Talk Radio.
Good morning. Welcome back to First Talk with Hal Rowe on 1290 WHKY Talk Radio for the Greater Hickory Metro. We're going to be talking this morning about surgical weight loss with some folks from Frye Regional Medical Center. Joining us this morning, Dr. Jim Cook, who was in last week. We did a business brief with him, medical director of Frye's surgical weight loss program. Dr. Monty Cox, a bariatric surgeon. Also, and I've just got to say this real quick because people were listening during Rock Barn this past year, and I can attest to he's shaking his head. I can attest to his surgical acumen. He helped me very much with some surgery that I needed in an emergency situation. The guy does great. No scars back here. My wife's real pleased with with the job that you did. So I can attest to his other surgical skills. He did a great job for us. And we're going to start off this morning with Miss Becky Steele, who is program director of Frye Regional Center's Medical Weight Loss Program. Nice to see you, Miss Steele. Thank you for joining us.
Thank you for having us.
Now, we kind of start off with you. Let's say that because we have a seminar tomorrow night, a Park Inn over here in Hickory, and someone attends this and they decide, well, I have really just struggled with weight loss for a long time. I've done everything I could. I've tried support groups. I've tried dieting. I've tried working out. I've tried every diet there is in the diet section, and just nothing is working for me. New Year's resolutions. Okay, so maybe surgical weight loss will be a good thing for me. We start off talking to you. Is that right?
Yes.
What help me with the ascertainment? Some of the things that you do to confirm or to ascertain that someone may be right for surgical weight loss, because it's not right for everybody. Let's kind of start with the procedure. Say I go to the seminar and say, "Hi, help me. I may want to consider this." Tell me where we start.
So the first step would be to speak with someone in my office.
Right.
And first thing we do is do a brief screening, which we can do tomorrow night at the seminar or just with a phone call to the office, just to make sure that you meet the basic criteria.
Okay.
Part of which is that you have to have a body mass index of 40 or greater,
Okay.
or 35 or greater with certain medical conditions.
Okay.
You have to have tried other diets and failed in the past. And there's a list of criteria that we provide to patients. But if we determine that you meet that criteria, then we give you a packet of information that you get back to us. And first step is to get you scheduled for an education class.
Okay. Now, the education class, what happens there? Help me with that.
Well, you have to bring your support person with you. That's a requirement of our program.
Oh, you have a support person that you work with?
We ask that you have a family member or close friend that
Okay.
is your support person throughout this process.
Okay.
So that when we educate the patient, we also educate that support person.
Okay.
And they're with you throughout the preoperative process, of course, through the surgery, and then postoperatively to provide support.
This is a lot more than somebody just driving you home.
Absolutely.
This is somebody who's going to be like, and I'm guessing, husband, wife, current significant other, maybe a son or a daughter in some cases?
As long as they're of legal age, yes.
Okay. And someone, I guess, who is intimately connected with you and wants to see you succeed
Absolutely.
at this. How much? Now, this is kind of the start. This is where you will start. How much do you do as far as the follow-up goes and following up with the patient, the success rate, all that kind of stuff?
Well, we're very fortunate in our program that we have lifetime follow-up.
Okay.
And so our staff, along with Hickory Surgical staff, sees the patients at least 5 times in the first year postoperatively and at least annually after that. As long as patients come back, we want to see them.
Is this pretty much the standard? If we do this in Colorado, if we do this in Miami, if we do this somewhere here in the United States, this is kind of the standard. This is what people do. You go in, you have an ascertainment, you go through this. And this is the reason I'm asking this is that we want to make sure that people understand this is not something that you do willy-nilly. This is not something you do just, I think I'll do this. It's not like going out and buying a diet book. This is a big a life-changing procedure.
It's a huge commitment. And it is the standard for programs that are designated as centers of excellence.
Okay, and that is
Which we are.
Is a center of. Now you're also a dietitian, nutritionist, is that
Yes,
right?
I am.
Help me with the follow up and what this means, because this is going to mean a change in diet. This is going to mean you just can't go back to the lifestyle you were leading. I mean, this is also going to be a change in lifestyle as far as nutrition, and help us with that.
It's a very large commitment for the patient, but we do a lot of education preoperatively, so I think our patients are really well educated and prepared. And as long as they commit to making the changes, they're very successful. But our follow-up includes looking at certain lab values to make sure they're getting the vitamins and minerals that they need, that their protein status is good. It also allows us to help patients to stay on track and make sure that they're following guidelines. And if they get off track a little bit, we're able to steer them back. That's what the follow-up is all about.
Now, we've talked about meeting with the surgeons 5 times, and then the post-operative the year after we have the. But how about y'all? How about in the program? How often do you meet? Do you meet weekly? Do you meet every month? How often will somebody from the actual program be in touch with a patient to make sure that they do exactly what you're talking about, staying on the right track, getting the proper nutrition?
Our follow-up is pretty much aligned with the schedule as they see the surgeons. So we see them each time that they see the surgeons.
Right.
And then we're also available pretty much 24 hours a day for phone calls. So if patients need to call us or come in any other time, we make ourselves available. And then we do monthly support groups also that we encourage patients to attend.
Maybe someone's sitting on the fence, they're listening this morning, and they're saying, I think I might just give it just one more try. I may try this weight loss. But I can get on the, I can get on the treadmill. But yet they fail. What would you say to them as far as their consideration of and taking a look at some type of surgical weight loss? What would you say to them?
Well, I would encourage them to at least attend an educational seminar so that they have as much information as possible before they make that decision.
Right.
And I would also encourage them to speak to other patients that have gone through this process. I think that's very important.
As you talk to these folks who come in, because you're kind of that point of contact initially, you're the person who they talk to. How many folks have misconceptions and really don't understand what's going on? Or do you think that people do the research who are interested in this? Do they go on the internet? Do they talk to other people? Or are there still a lot of misconceptions out there about the program?
I believe there are probably misconceptions in the general community, but the patients that come to us are usually very well educated. They've done a lot of research. Many of them have been looking at this for a couple of years.
Right.
And we don't want it to be something that they jump into, so we encourage them to do their research.
Okay, now are you going to be there tomorrow night at the park?
Yes,
Okay.
absolutely.
Do I have the rights tomorrow night?
Tomorrow night, 6:30 at Gateway. Many of our staff members will be there also.
Okay, very good. When we come back, we'll talk with the medical director of the program, Dr. Jim Cook, and also bariatric surgeon, Dr. Monty Cox. More First Talk right after this break. Good morning. Welcome back to First Talk with Hal Rowland, 1290 WHKY Talk Radio for the Greater Hickory Metro. We're talking about weight loss surgery this morning. We're talking with the staff of the weight loss surgery department at Frye Regional Medical Center. We were just speaking with Ms. Becky Steele, program director. Now we're going to talk with Dr. Jim Cook, the medical director, and Dr. Monty Cox, bariatric surgeon. So we go to the seminar. We find out a little bit more about it. We probably have done our homework maybe on the internet. We've talked to other people. We find out a little bit about what's going on because this is a big procedure. This can be life-changing for folks. So the office there ascertains that, okay, we're a good candidate. We've got the BMI over 40 or 35 with certain medical conditions. We've tried weight loss before. It has not worked for us. We get qualified through through insurance and that part of it. Then we go to the education classes, which Ms. Steele was talking with us a little bit about. But also in these education classes, we'll meet a couple of the surgeons. Which one of you would like to start and tell us a little bit about what happens at these classes? Why don't we go to the medical director, Dr. Jim Cook, and what happens in these classes at the hospital to start us off?
Well, as patients progress through the program, the information gets more specific.
Okay.
And specifically, the information and the evaluations become centered around the patient
Okay.
as opposed to just general information. Weight loss surgery is not like other kinds of surgery in that there's a lot more involved than just an operation. In fact, maybe the operation is, we look at it as 50% of the program.
Really?
Patients have to learn about nutrition, about a lot of other things other than just the operation. So that's why it takes a while to go through the evaluation. And one of the criteria, one of the ways that we select patients is we have to be sure that they understand the process and what's involved. You know, how do you make a weight loss operation work?
Right.
Again, it's not just the operation.
So, Dr. Cox, when someone comes into one of these classes and you're kind of doing the general information, Dr. Cook told us during the break, if they know you or know Dr. Cook, they may choose to have you as their surgeon. If not, there's a rotation. So you'll meet with actually somebody during one of these small class sessions, and I guess that's where your physical workup and kind of overview starts with them, is during these classes?
Well, during these education classes, really what we're trying to do is make sure that people understand what choices there are in terms of weight loss surgery, because there are choices, and sometimes people come in with sort of preconceived notions about which operation they think is safer or easier or something like that. And none of these operations we consider to be minor surgery. These operations, you have to sort of have a good understanding of how the operations work, what we really do, and how it changes the way you eat, how it changes your relationship with food. And so this is how you get good long-term results. And so when people come to an education class like this, really what we're doing is giving them information about what options are available, what we offer,
right,
and how it works. And it's not until the patient comes at a later point in the process that we actually get down one-on-one in a private setting, and just like people normally think of in a doctor's office, where we can do a physical examination to get the patient ready for surgery.
Help me with some of the terms that we're going to be dealing with this morning as we go through the show. Bariatric surgeon, bariatric, help me with that.
Well, bariatric just means weight loss. When we talk about bariatric surgery, it just means weight loss surgery.
Weight loss surgery, okay. There's a couple. You were talking about the different options that we have as far as surgery. I remember years ago when we were talking about weight loss surgery, basically it was gastric bypass surgery. Let's talk a little bit about that. Is that still an option? Is that still what we do? Is that an operation that's still done?
Gastric
Dr.
bypass, yes, is still the most commonly performed.
I'm going to move this microphone over just a little bit so we can hear that good booming voice of yours. There we go. Go ahead, sir.
Gastric bypass is still the most commonly performed operation for weight loss in this country.
Okay.
And gastric bypass has been around a long time, probably since the late 50s, early 60s. Of course, like most things in medicine, some of the technical details have changed. Certainly our instrumentation has changed. New things like laparoscopic technique have come into play. And again, as we've already mentioned, we've learned a lot more of the other things like nutrition and that kind of thing that go along with it.
Now, you said in this country, I want to just take a minute here and just veer off for just a second, because you said here in this country, there's also people who will seek medical attention in other countries, medical tourism. They'll go to another country and say, oh, maybe I can get it cheaper in Mexico, or, oh, we're going to Acapulco this year, and while we're there, I'm going to have, probably something you're not going to recommend. You really need to take a look at this. As we've talked about, this does have a certain gravity to it, and we want to make sure that people understand they want to seek out the very best that they can.
Right. Well, there are opportunities, let's say, for people to go to other countries to have surgery, not just weight loss surgery, but heart surgery,
right,
orthopedic surgery, all kinds of things can be done in other countries. And perhaps people have seen some of these programs on 60 Minutes, that kind of thing.
Right. Usually not a good sign if you see them on 60 Minutes.
Well, it can be
right,
a bad thing.
Right.
So, in these economic times, in the past, there probably have been some financial incentives for people to do this.
Gotcha.
I think we have prices that are competitive with anything you can find anywhere else in the world.
Right.
So I think we've pretty much put that to rest in terms of, the financial incentives.
Right.
There are some problems with going elsewhere to have major surgery. One of the biggest things is follow-up when you get back.
Right.
These people come back and they have no follow-up arranged. They have no arrangements made with a doctor.
No support system. Right.
Right. So we think that's a significant problem.
Let's talk. Let's get back to the types of surgery. Gastric bypass surgery. I'm not a doctor. I don't even play one on TV. I didn't stay at a Holiday Inn Express last night. Help me with the general term, if you were explaining this to somebody very simply, what gastric bypass surgery means, what that is.
Well, like Dr. Cook mentioned, gastric bypass has been around for many years, and people may know people who have had what they called a stomach stapling procedure back in the 80s.
Okay.
That we hear that kind of term a lot. And so they were... When we do a gastric bypass operation, basically, what we do is reduce the size of the stomach to a small pouch. So instead of having a larger capacity for food, a person should feel satisfied with a much smaller quantity of food. And that reduces the number of calories they take in. And it really does boil down to being able to have a sense of satisfaction with a very small meal.
Okay.
And if a person's taking in small meals, then over the course of the day, over the course of several months and over the years, they're going to be able to lose weight, a substantial amount of weight, and be able to maintain that weight loss in a way that sort of provides a sense of satisfaction with smaller meals.
Now help me with this. You say now we can do it laparoscopically. Is that am I pronouncing that close?
Yeah, that's exactly right.
Okay.
Yeah.
It used to be, I guess, you had a larger incision. And actually was a little bit more advanced type of surgery. Now you were talking about, to Dr. Cook, you were talking about the equipment and what you're able to use, and I guess the procedures now, like in a lot of medical procedures, we've learned how to do this in a more efficient manner?
Well, the incisions that we make are much smaller. Basically, we make an incision, a series of incisions that range in size from about 1/4 of an inch to 1/2 an inch, and we actually are able to put a TV camera into the abdomen and do what we need to do that way. And the things that make that possible is what Dr. Cook was referring to. The instrumentation has gotten a lot better. The staplers that we use now are much better than they were 10 or 20 years ago. And really we have the technology to be able to do that. And it makes things significantly easier for patients. It's still a major operation, even though the incisions are smaller, but
right.
it makes sort of the recovery and sort of getting back up on your feet a lot easier than having a big incision.
You said stapler, so I guess that what you're doing is you're actually taking and just closing off a part of that stomach. That's a part that. Now I got to ask this because I'm thinking, what happens to that part of the stomach? Atrophy? Does it just kind of go away? Does it sit there? Is it healthy tissue? Help me with what happens with that part of the stomach. And do you ever have a situation where you go, okay, we're pulling the staples out, and this part of the stomach still is okay?
Well, the bypassed part of the stomach shrinks a bit. To go back a little bit, a gastric bypass, basically what happens is 95% of the stomach is bypassed.
95%, okay.
Now, that's just sort of originally years ago we thought that was just sort of an incidental part of the operation, and that gastric bypass worked mainly because it restricted how much you can eat.
Right.
In the last few years we've learned that there are a whole lot more things that happen that are related to various hormones and chemicals.
Okay.
So, for example, when a person has a gastric bypass, not only is their caloric intake mechanically restricted, but, for example, within a day after you have a gastric bypass, blood sugar starts to go down. Blood pressure gets better. One of the other things that cause diets to fail is your appetite goes up. Because of these hormonal changes in a gastric bypass, you don't get a big rebound increase in appetite after the procedure.
We'll talk more about, and there's other types of surgery too, so thank you for helping with the explanation there, gastric bypass. When we come back, I want to talk about the other opportunities that we have for surgical weight loss, and of course about the successes, and maybe that you've both experienced, and what may be right for different patients. More First Talk after this.
WHKY, your source for local athletics across the Hickory Metro.
Good morning. Welcome back to First Talk with Hal Rowan, 1290 WHKY Talk Radio for the Greater Hickory Metro. We're meeting with members of the team this morning of Frye Regional Medical Center's weight loss surgery program. Ms. Becky Steele, the program director. You will probably, if you consider this, meet with her one-on-one first. You'll probably talk to her at maybe at the seminar that's happening tomorrow night. And then along the way, you very possibly will meet with Dr. Jim Cook or Dr. Monty Cox, who are the surgeons. Dr. Jim Cook, of course, the medical director of the program. Before we went to the break, we talked a little bit about diabetes. And the fact that when we shrink the stomach, and by the way, the question y'all helped me with during the break, when you sequester off that part of the stomach, it's still making all the stuff it needs to make. It's still making the acids. It's still doing everything. It's just sitting there. It's just not the big pouch anymore. Right. It's reduced that size. But you talked about the fact that this is helpful immediately for diabetes, for blood sugar, for a lot of other things, a lot of other benefits other than this than just restricting the intake of calories.
Right. Probably the biggest development in weight loss surgery is our understanding of the chemical, the hormonal aspects of these operations as opposed to just the purely restrictive effects.
Okay.
We know that after a person has a weight loss operation, you're not going to be able to eat as much.
Okay.
And certainly that's important. But what really is exciting these days is to find out about the effect on diabetes, the effect on blood pressure, the effect on lipids, heart disease, all of those other things.
I want to talk with Dr. Cox, bariatric surgeon, again, Frye Regional Medical Center weight loss program. We talked about gastric bypass. There are other surgeries that we have as well. Help me with some of those.
Well, another operation choice that a lot of people have heard of is the adjustable gastric band or the lap band operation.
Lap band, right, okay.
Yeah, we do that as well. And there is a relative newcomer on the scene called a sleeve gastrectomy.
Okay. Tell me about the lap band, because I can pronounce that, and we'll kind of start there.
Lap band's a little bit easier to pronounce.
Right.
But the lap band operation, again, is just another option, another way, another method that we can restrict the size of the stomach.
Okay.
But we do it instead of using a surgical stapler, we do it by placing an adjustable sort of band or belt around the upper part of the stomach. And it's connected to a port that we can actually access later on down the road and adjust how much restriction that band provides. And
so if we're eating too much and still trying to eat too much, we can restrict that, tighten it down a little bit to reduce the...
Well, the band doesn't change the size of the stomach. What it does is it changes the amount of restriction
Gotcha.
that the stomach has on it. And so basically... again, the idea is a person should be able to achieve a sense of satisfaction with a smaller meal.
Okay.
Reduce the number of calories, but do it in a way that sort of helps them have that that sense of satisfaction that helps them stay on track.
Which is a big part, I guess, of overeating and the way that people get in that situation in the first place. Dr. Cook, do you still have the same results as far as what's going on with the sugars and the lipids and the with this type of surgery as well, or is that pretty much with the...
No, you don't get those chemical hormonal effects with a band.
Gotcha.
And the reason is because we haven't really changed the anatomy around. Basically, with a band, you put a tight band around the upper part of the stomach.
Right.
Now, certainly you get some weight loss, but you don't get quite the effects otherwise that you do on the diabetes, blood pressure, and those kinds of things.
Now, you all will make this ascertainment as part of the medical workup that you're going to do on the patient. Once you meet them and you get in and you're either assigned or a patient requests you, you're going to say, okay, we think the gastric bypass is appropriate here. We think this is a type, or we think that the lap band may be appropriate. Y'all are going to make that ascertainment.
Most of the time when patients come to us, they got a little bit of an idea about which one they would prefer.
Really? Okay.
And by the time they get through the education process, they're going to have a lot more information about how the operations really compare to each other, and they have a much more realistic sort of understanding of how the operations work and how they compare. And usually, sometimes they kind of change their mind about which operation they want by the time they go through that process, which is fine. If they're basing it on information and a better understanding. And sometimes people might make a choice that we feel like is not maybe in their best interest. Maybe there's a better choice, and we'll help guide them in the right direction. But we offer a choice because, for most people, probably for the majority of people, any of these operations would probably be fine. As long as they understand how it works and are compliant and are very consistent with their food choices and things like that.
Big part being compliant. Just a couple things I think that people I know I'm interested in. We talked about during the break real quick. You don't go in for surgery and come out skinny. There's no lipo here. You're not removing fat. You're reducing the size of the stomach or reducing the calorie, right? You don't go in for surgery and come out looking like a new person. It's not cosmetic.
Right. Now, one of the things we do ask patients to do prior to the operation is a short low-carb liquid diet, which helps to prepare a person's body for this type of surgery, helps us technically a bit with certain things. So a patient might lose 10, 12 pounds preoperatively.
Right.
But that's correct. You don't come out of the operating room with significant weight loss.
And also, I was disappointed to hear that just by not eating, I'm not going to shrink the size of my stomach. And overeating, which on the good side, I'm not going to expand my stomach terribly. You were telling me it's a pouch. It's basically a repository for food, and it pretty much whatever you've got is what you have. You're not going to stretch it out by a big Thanksgiving meal. You're not going to shrink it up by trying to limit your intake. That has to be done surgically, or that has to be done with a lap band to reduce that feeling of fullness. That's correct.
Right.
Okay.
Sometimes people find that there are people in their family or their community that'll tell them, why don't you just find out what kind of foods those gastric bypass patients are eating and just eat that, and just limit your calories that way. And again, the idea is maybe you'll shrink your stomach that way. But my response to that is I can guarantee you, basically anybody who has been struggling with their weight and with morbid obesity has already tried that. They've already gone down that road trying to cut their calories, and basically the body kind of kicks into gear and opposes those weight loss efforts, and that's why they fail. But surgery provides a mechanical change, and in the case of a gastric bypass especially, it provides that hormonal chemical change in the metabolism as well. And so it's not really the same to try to restrict those calories.
Let's talk about the sleeve before we go to the break. We got just a couple of minutes, and that's the other. I guess the other one that we're looking at, the three major. Is that the three major types?
Right.
Okay, and help me with it. What's it called again? I picked up on sleeve, but I did not get my.
It's called a sleeve gastrectomy, which is
okay.
Which is an operation where we actually remove the majority of the stomach to actually restrict the stomach in that way.
Remove surgically the majority of the stomach.
Well, basically, what you do is you make a narrow tube out of the stomach.
Okay.
And so part of the stomach is removed, and there are some technical reasons that we have to do that related to blood vessels and that kind of thing, as compared to a gastric bypass where we don't remove the bypass stomach. Sometimes that's a point of confusion with patients, but it's basically just surgical technique. But so a sleeve gastrectomy, what we do is make a narrow tube out of the stomach, which causes restriction, and you also get some of those hormonal effects that you get with a gastric bypass.
A friend of mine was just diagnosed with cancer, and then I was surprised to find out that they had actually removed his stomach. That was part of the diagnosis, and I said, well, how do you live without a stomach? And they said, well, absolutely, you certainly can. It's so in this case, I'm sure it's not as dramatic or the same type, but it would surprise me to find out that was not something that was necessary, simply a repository, and you can remove it, or in this case, a good deal of it, and make it, instead of the repository or the pouch, simply a sleeve. So very interesting. Our guest this morning, Dr. Jim Cook, Medical Director, Dr. Monty Cox, Bariatric Surgeon, and Ms. Becky Steele, Program Director of Frye Regional Medical Center's Weight Loss Program. The ones that we're talking about, pretty much we're talking about very small incisions. We're not talking about going in and doing a big, when I say operation, as far as a lot of stitches, a lot of scarring, things like that. This is not, and maybe it was in the past, I don't know. But in this case, we're talking about, and sometimes, from what I understand, single incision in surgery?
Right. Most abdominal surgery these days is done laparoscopically.
Okay.
All kinds of abdominal surgery. And the reason you do a procedure laparoscopically, number one, it doesn't hurt as much.
Okay.
You can be up and walk and be active. You get out of the hospital quicker. You go back to work quicker. There's less risk of an infection because you don't have a big incision.
Right.
So there are all kinds of good reasons to do procedures laparoscopically. Sometimes we still have to make incisions, but most of the time we can do it laparoscopically.
How important is it that we get back up? You talked about going back to work. Well, I want to come back. I want to talk about the follow-up. Now that we've talked a little bit about the surgery, we go in, we have the surgery. We understand that we're going to have restricted calories. In some cases, we'll have a better picture with the hormones, with lipids, and a lot of other things. Sometimes we'll just not quite be as hungry. Let's talk about recovery and where we go from this after the surgery when we return next. Good morning. Welcome back to First Talk with Hal Rowe on 1290 WHKY Talk Radio for the Greater Hickory Metro. Of course, talking about surgical weight loss this morning. And having it done, first of all, United States of America, having it done in our area, because we talked a little bit earlier about medical tourism, having it done right here. And it is something that you do need to consider. You do need to do your homework on. Attend the seminar that's happening tomorrow night. If you think you may be right for this, or if you think somebody else may be right for this in your family. Somebody, it breaks your heart to see them. You know that they're big. You know that they're not doing anything about it. They become discouraged. And you say to yourself, goodness gracious, we got to do something here because it is a health issue. And maybe there's a good way to broach that subject. We'll talk with Miss Becky Steele, Program Director, before we wrap up this morning. Dr. Cox, you did want to mention also, it is you, it's Dr. Cook, and there's another member of your team as well who could not be here this morning because he's in surgery.
That's right. That's Dr. John Hatta. And we want to mention that we're all partners in the same group. We're, part of the Hickory Surgical Clinic. We all offer the same operations, and each of the three of us, if you come to one of us, it's going to be a part of that same program.
I wanted to talk about some of the other aspects of the program before we wrap up this morning. Physical activity, big part of it. Is that what you want to do? You want it when you because we talked about the fact you don't get up from the surgery and you're a changed person immediately. You're going to go through some changes. Do you? I'm sure that physical activity is part of that. That's what you want to see. Dr. Cook, you talked about the fact that in some of these cases, due to the fact that it's done laparoscopically. Did I get all the syllables in there? Most of them.
Close enough.
Thank you. Close enough. I'll go with close enough. Get you up to work quicker. Get you up and moving quicker. And you're going to say physical activity.
Right.
Get out there and start moving.
Physical activity is critical. We like to get people up very quickly after surgery because there are some potential complications related to inactivity in the hospital.
Okay.
So we get people up walking that afternoon. And then we encourage people to continue to walk and do some things at home right after discharge. Then as time progresses and a person heals, you don't have to join a gym and do all of that, but just walking,
right.
Increase the number of steps per day. And so that helps burn up calories. It also helps with muscle toning and just a general feeling of well-being.
I want to ask Dr. Cox, we talked a little bit about this earlier, the psychiatric aspect. You've got a psychiatrist or somebody who meets with or someone who on psychiatric staff, because sometimes the changes can be incredible that happen with a person, and you want to make sure that, first of all, prior to, they're going to be ready for this, and follow-up. It's going to be very important as well.
That's right. It's a psychiatrist or a psychologist in most cases. And basically that's just a screening evaluation to make sure that a person has the support and the resources to be able to cope with what could potentially be a very stressful event. We don't do this because we think patients are crazy, and that's an important thing to point out. The incidence of psychiatric illness in obese patients is the same as in anybody else.
Gotcha.
The only thing that is an exception to that potentially is depression.
Right.
We want to make sure if a person has depression that it's managed appropriatly, and that we're not going to run into trouble with that, after a stressful operation.
Let's talk a little bit, if I could, Dr. Cook. Let me ask you, when we're talking about the follow-up, we're talking about changing people's lives. Because I'm going to talk with Ms. Steele about the follow-up for the whole program. But you actually have at Frye Regional Medical Center a whole department that's kind of dedicated to this. Is that right? You have actually people you're talking about getting people up and walking that afternoon. You actually have people who are dedicated to this as part of the staff that is part of the whole program. Not just, okay, you're up walking around, see you later. You actually have people who know what's going on, staff members other than yourselves, nursing staff, other people who know what's going on with weight loss.
Right. We have members of the staff at Frye Regional Medical Center who've been involved with this program with us ever since we began. People in the operating room, nurses on the floor.
I didn't even think about that. OR, people who are familiar with the procedure, who know what's going on there.
The anesthesia staff. It's very important that other people understand the operation, the people that help us. It makes a tremendous difference in the outcome, the reduction of complications, and that kind of thing. And then nurses on the floor who know how to take care of patients after an operation like this. Physical therapists, all kinds of people in the hospital that sometimes you don't think about, but it's tremendously important in this situation.
Do you ever see somebody in the grocery store or you're out and about and you don't recognize them?
Absolutely.
Dr. Cox is smiling here. Obviously, that's happened to him. Somebody said, and you think to yourself, how do I know this person?
Absolutely.
And it's just changed their appearance totally.
Right. Somebody will come up and say, "Hey, Dr. Cook, do you remember me?" And I scramble and try to think and think.
Run through that mental Rolodex,
but sometimes you absolutely just don't physically recognize a person right off.
And it's that change. They've stuck with the program. They've done what they've needed. You've done what you've needed to do.
Yeah.
They've done what they needed to do on their end. And it's worked, and they look like a different person.
Right.
I'm going to talk with Ms. Steele before we wrap up this morning. Dr. Jim Cook, Medical Director, Frye Regional Medical Center's weight loss program. Thanks for joining us this morning. Dr. Monty Cox, bariatric surgeon, want to thank you as well. Appreciate you coming in so early. Of course, you're talking to surgeons. You guys get up early anyway. We hope that you're have had your coffee and breakfast before you head in. But I want to thank you for joining us as well. Ms. Steele, you're one of the first people that we're going to see when we enter into this program. And you're going to be the one who's going to shake our hands, one of the last people that we're going to see or stay in touch with. And so let's talk a little bit about, now you've got the seminar coming up tomorrow night.
That's correct.
Okay. And you also want to let people know, as they attend the seminar and find out some of the reasons that, the Centers of Excellence, the fact that you have the staff there. Let's talk a little bit about, because y'all were kind enough to talk about weight loss in a general sense, let's talk a little bit about Frye this morning and what you feel kind of sets you apart.
Okay. Well, first of all, probably most importantly, we've been doing bariatric surgery for the past 10 years.
Okay.
So we have lots of years of experience. We've done nearly 2,100 bariatric procedures. So our experience includes the surgeons, of course, but an entire multidisciplinary team.
Right.
Lots of these folks have been around since the beginning. The folks that Dr. Cook spoke about in the hospital,
right.
And then also in our outpatient clinic, we have our own dietitian, we have a couple of our own nurses, our own team psychologist, insurance experts, just a lot of folks that are very dedicated, our own nurse practitioner that works just with our patients. So we're just very dedicated to this program and to these patients. And we've been designated as a bariatric surgery center of excellence, most importantly from the American Society of Metabolic and Bariatric Surgery, but also by several different insurance companies.
Yeah, and insurance. Is this covered by insurance generally, sometimes, or is it, you'll determine that, I guess, when you meet with folks?
Well, we will determine that, but most of the time, insurance companies do cover these procedures because they've seen the results.
Okay.
As far as our designations, we are a Center of Excellence for Blue Cross,
okay.
for Aetna, Cigna, and United Healthcare. So a lot of folks are kind of sent to us by their insurance companies because we have that designation.
Okay.
Basically because we have a proven track record with our overall performance.
We've got 1 minute, almost less than 1 minute. Anybody who would say this is the easy way out, what would you say to them?
Absolutely not. Our patients work very, very hard to be successful, and they have to change many things in their life in order to be compliant with our guidelines. So I would say it's probably more difficult than most diets out there.
Very good. So nice meeting you and having you in this morning. We sure do appreciate it. I want to thank all the members of the team who came in and helped us understand a little bit more about surgical weight loss. If you want to find out more, you think it's going to be appropriate, tell us if you would, Ms. Steele, before we wrap up. You got a seminar coming up tomorrow night, right?
6:30 p.m. at the Gateway Conference Center in Park Inn.
Okay. If people want to go to the website,
they can go to Frye Regional Medical Center website to register, or just show up. Everybody's welcome. Okay, very good. Again, I want to thank Dr. Jim Cook, Medical Director, Dr. Monty Cox, Bariatric Surgeon, and Becky Steele, Program Director, Frye Regional Medical Center's Weight Loss Program. Head to the seminar tomorrow night, or ask any of these folks. You see them out and about. They're members of our community. Stop them if you know Dr. Cox in the grocery store. Say, what is this little thing? No, he's not going to tell you what. He's going to say, make an appointment with me or go to one of the seminars. But seriously, talk to them or anybody who's gone through this procedure. Find out more. It may be appropriate for you or for a loved one. We're going to go ahead and close the way we normally do, Monday through Thursday, with the greatest song in the world for the greatest nation in the world. Ladies and gentlemen, our national anthem.
Thanks so much for joining us on First Talk. We know you have a choice in morning radio. That's why we appreciate you choosing the First Talk radio program. Tomorrow we'll be talking about the Hot Stove Banquet with the Hickory Crawdads. You know, if the Hot Stove Banquet is coming, baseball can't be far away. More First Talk tomorrow morning. Be grateful for what you got. Make it a great day. We'll talk tomorrow on First Talk.